My name is Michael Richard. I've been in practice for 17 and a half years. I practice here at the Nagel Center in New Jersey. I also practice at Duke University. I'm originally from Rhode Island, and my education took me to California and Boston and North Carolina. I'm most proud of the work I do training surgeons of the future generation. When I was at Duke, I trained 10 fellows and countless residents. I also am very proud of the volunteer work I do in Ethiopia, which is focused on training doctors there to do the work we do. I began my work there 10 years ago. I've been with this organization for 23 years, where we go to other countries and train doctors to our specialty. When we got to Ethiopia 10 years ago, there were no oculoplastic surgeons there and 120 million people. We've trained 9 surgeons so far, and I go twice a year to work with them and continue the training. I think as a physician, it's really important to stay current with the latest trends and with the latest technologies. And I think it's especially important in ophthalmology and in plastic surgery, where technology and innovation drive what we can offer patients. I'm really lucky to work with Dr. Nagel. She does a great job staying ahead of the curve in that way. She always has industry coming in to work with us to teach us the newest techniques and innovations. We also go to meetings fairly regularly, and we can learn a lot there. I'd say lastly, when I go down and work with the residents and fellows, I'm introduced to the latest techniques down there and get to share ideas with my colleagues down there. And I think in that way, it keeps me current and I can give the best care to my patients. Our field is unique. We're operating on everyone's face. Every surgery, people talk about cosmetic surgery. Cosmetic surgery just means it's something that's done not for medical reasons. Every surgery we do is aesthetic surgery, meaning that it has to look good, whether it's just being done to rejuvenate the face or if it's being done to fix a medical problem. So we're operating on eyelids and cheek and face. You can see every incision. You can see the contour of everything. So every single surgery we do is aesthetic in that nature. And I think being able to offer patients surgery or medicine that can improve their life and make them look like themselves is really important. I pride myself on providing thoughtful, understanding care. I think the patient experience is really important. I think there's a movement in medicine, and it's probably a little late coming, but people are recognizing that when you're a patient, you're very vulnerable. And part of being a doctor, the art of that is to make patients feel at ease and guide them through the process. So I take my time with patients, listen to their questions, I'm available. So when you come to UltraSelf, that's something that patients can expect, and it's something that I pride myself in.